My name is, good evening everybody, good evening the chairperson. My name is Abiodun Sanni Falilat Iyabode. I'll be presenting a topic, a research work I did on knowledge and use of standardized nursing languages, a study conducted among nurses at the Federal Medical Center, Owo, in Ondo State, Nigeria. The summary of the study. The study was carried out to know the level of knowledge and utilization of standardized nursing languages among nurses at the Federal Medical Center, Owo. Before I proceed, I would like to define standardized nursing languages. Standardized nursing languages simply means a terminology that is used by nurses in the assessment of patients, identification of outcome, and in intervention. This study was aimed at identifying nurses' familiarity with the language, their level of knowledge used in patient care, and also to identify the possible barriers that might prevent the use of the language in practice. The results showed that nurses have a poor knowledge of standardized nursing languages. They are more familiar with NANDA, which is the major method of documentation being the paper method. Majority of these nurses do not use standardized nursing languages in their documentation. Major barriers to successful utilization include poor knowledge of standardized nursing languages, the poor hospital policy, lack of basic amenities, shortage of personnel. The research work also revealed that nurses' year of experience and their level of education does not affect their knowledge of standardized nursing languages. High-quality nursing documentation promotes effective communication in the healthcare team, which facilitates continuity and individuality of care. The use of standardized nursing languages promotes quality nursing documentation and enhances the visibility of the contribution of nursing to patient care. This study will create more awareness about standardized nursing languages and emphasize the need to fully incorporate the use of this language into nursing practice, provide a foundation for future efforts and studies concerned with inclusion of standardized nursing languages into nursing documentation within the clinical settings, and also assist nursing management of health institutions to see the need to incorporate the use of SNL into nursing practice. And this goes a long way in achieving the goal of transition from the traditional practice to the evidence-based practice, and also enhance communication between nurses and other healthcare professionals. In April, the background of the study. In April 2010, the Department of Nursing Science of the Obafemi Awolowo University in Nigeria, in collaboration with Nanda High International and Iowa College of Nursing, the Center for Clinical Classification and Clinical Effectiveness, organized the first regional conference and training of trainers workshop with the theme Development and Use of Standardized Nursing Languages in Nursing Education and Practice. I was part of the conference where the standardized nursing languages were introduced with emphasis on NANDA, NIC, and NOC. Despite the introduction of these standardized nursing languages, the formal launching of NANDA, I still observed that even the nurses, they still use the Gordon's functional health pattern, yes, to derive their diagnosis, most of which were not correct. The NOC and the NIC were also not in use. Rather, the traditional objective statements and the nursing order were still being used. There are lots of discrepancy in the way nurses define and classify patients' problems in different settings, which give rise to problems of communication, especially in patient transfer from one care setting to another. Hence, I was motivated to assess the current level of standardized nursing languages among these nurses, their use of the languages, and also look into the possible barriers that might affect proper implementation and adoption. The methods used are: the research design is both descriptive and correlational. The study was conducted at the Federal Medical Center, Owo. It's an ancient city located in the southwestern part of Nigeria, a 3-bedded hospital with a staff of about 1,200 health professionals, out of which nurses constitute about 350. A non-probability convenience sampling of the nurses at the Federal Medical Center, Owo, was used, and a total of 250 questionnaires were distributed with 98% response rate. All nurses practicing in the various units of the hospital were considered for the study, as they all have contact with patients one way or the other. A self-structured and administered questionnaire was used. It was divided into 4 parts to determine the demographics, knowledge, familiarity, utilization, and barriers to successful implementation. The study is of low risk to participating subjects and the facility. The copies of the research proposal was submitted to the ethical review board of the hospital for approval. and the questionnaires were administered to each nurse met in various wards or units during the period of collection. Same was collected back from the nurses after 2 to 3 days. The data collection lasted a period of 2 weeks in all. The data was entered using the SPSS software version 22, and analysis was done using the tables of frequency and percentage, mean and standard deviation, chi-test, and the correlation was done using the POC correlation method where necessary. Discussion of findings. The major method of documenting nursing care in the hospital is the paper method. It was also revealed that none of the wards in the hospital has a functioning computer system. This is consistent with a case study by Matthew K. et al. In 2014 to assess nurses' attitude towards computerization and also the use of computer at work. This study was conducted in 2 hospitals, both private and public, in Nairobi, Kenya, and revealed that only one of the nurses have access to computer system at work in the government hospital. Computers perform a wide range of activities which help nurses to save time with documentation, else improving efficiency of healthcare. Various studies conducted on standardized nursing languages have also shown that the use can be made easier with the use of electronic health record system. Statistics also show that a larger percentage of the nurses are familiar with standardized nursing languages but has a poor knowledge of this language, as only 37.6% of the respondents were able to give correct definition of standardized nursing languages, while 62.4% have a wrong definition. Only 30% recognize Nanda, Nik, and Nok as standardized nursing languages. Personal interactions with the nurses showed that some of them only read about it in books and journals. Only few learned about it in the school. They were able to give correct definitions, some of which were not given offhand but copied. The results. It was revealed that most of the respondents were familiar with Nanda. This is similar to the research by Olaogun et al. 2011 in their study conducted among nurses at the Obafemi Awolowo University Teaching Hospital, where it was revealed that nurses are only familiar with Nanda. Also in a survey by Tede and Squiren 2011 to assess nurses' experience and attitude at the Ohio State University, in which about 1,268 nurses were sampled. Only 4 out of the 12 were familiar. The most recognizable being Nanda, which over 1/3 revealed that they have used in the school. Method of documenting nursing care in the hospital. As earlier stated, the major method of documenting was the paper method. Nurses perceived barrier to successful adoption of the standardized nursing languages. The major barriers identified in the study include poor knowledge of the language, lack of basic amenities such as internet facilities and computer systems, poor hospital policy, inefficient continuous education, shortage of manpower, and some studies have also found and some have also identified the same, like Sanni and Sanni 2017 and also Tede and Squiren 2010. Then in trying to find out the relationship between the nurses' year of experience and their educational qualification in relation to their knowledge of standardized nursing languages, correlation revealed that there is no significant relationship between the year of experience and qualification, the nurses' year of experience, qualification, and their knowledge of standardized nursing language, the p-value being less than 0.05. Conclusion and future step. The feasibility of the electronic health record in practice setting has accelerated the need for nursing to communicate its practice within the structure of the electronic format. Hence, there is need to initiate use of computer system in the wards to enhance proper initiation of electronic records. There is need for continued development, testing, and refinement of standardized nursing languages to pave way for usage of data elements across populations and settings to communicate nursing practice, enable nursing administrators and leaders in healthcare system to delineate needed resources, cost out nursing care with greater precision, and design new models of care that reflect nurse-patient ratios and patient acuity data-driven. The evaluation of research to support the development, use, and continued refinement of nursing language is critical to research and the transformation of patient care by nurses on a global level. Policies must be in place to ensure and initiate successful adoption of standardized nursing languages in planning patient care. There is need to conduct a research work to determine the knowledge and the use of standardized nursing languages and also attitude of nurses towards electronic health recordings among nurses in the state. These are the references. Thank you.